Hello, and welcome to a special edition of Up Close on METV. I'm Charles Clapsaddle, Station Manager for Manatee Educational Television, and it's my great pleasure to have with us today Dr. Richard Conard, who is going to talk about a wonderful activity that took place right here in Manatee County and the plans for next year to make that encounter even bigger. And that's the Remote Area Medical Cooperation that Dr. Conard is going to talk about today. Dr. Conard, first of all, thank you so much for joining us today. I know how busy you are and how involved you are with the community, but the first thing I want to tell you is congratulations on a wonderful activity that took place right here in Manatee County, and that was the Remote Area Medical program that you spearheaded right here at Manatee Technical College. It was a wonderful event. You saw many, many people, did many, many procedures that we're going to talk about, but hats off to you for making that happen.
Thank you, Charles. Appreciate that compliment.
Well, last year, a Remote Area Medical is a national medical outreach program headed by Stan Brock and goes all over the country. And this was the first ever program that was here in the state of Florida. Is that correct?
Yeah, it was the first major event in the state of Florida. And Stan and his people would like to see more events in Florida, and we'll be working with them to accomplish that here in the state.
Well, last year and this year, you were the event chairman, and it was all held, it was November 21st and 22nd,
Correct.
And it was held at Manatee Technical College, which is a beautiful facility with a lot of capabilities out there. And tell us a little bit about the numbers of people that you saw and the number of participants that were involved.
Yeah, it was a real impactful event, Charles. That's a little bit over a 200,000 square foot facility, and every hallway of that facility really was transformed into a major clinic. And it lasted really for a long day and a half. We started on Saturday and ended early afternoon on Sunday. During that period of time, we saw nearly 1,900 people. Overall, there was over 4,100 healthcare encounters. And we had over 1,000 volunteers that helped us with this, of which over 400 were professionals, physicians, dentists, eye specialists, and all the ancillary support people for that. The rest were interested, concerned citizens who stepped forward and helped us with the processing and the triage of these people. And then we had 30 booths of education. One especially that I recall was the Coalition for Early Learning in Manatee, Sarasota County. They had donated and distributed over 12,000 books to children at the event. Yeah.
Well, I kind of want to recap for you because when you talk about the numbers, it's so impressive, and it was so well organized. The logistics were like perfect. People came; they lined up very early to participate in the program. They had a triage where people came in and they signed in, and then there were different areas set up throughout the facility for individuals to seek the kind of treatment that they wanted, and it was very impressive. You had a whole dental clinic set up in the main hall where people could come and see a dentist, they could get examined. You had a whole vision area that was for people that wanted to be examined for their eyes, and then they could get a free pair of glasses. But then you also had a medical treatment area for people that needed to see a physician or a nursing care. It was very, very impressive. And the other thing that was just so wonderful to do was the number of volunteers. People were helpful. They had a lot of initiative going for them. They were there because not only of the importance of the occasion, but they wanted to give back to the community.
Yeah, that's very well put, really, because if you look what was really accomplished, we brought to town the nation's largest charitable organization that brings free health clinics to communities, and RAM is so well organized. They came to town with all their huge trucks and semis and such, and all of this equipment is mobile. They brought 2 trucks, of which each could create 500 pairs of prescription glasses a day.
It's so impressive.
Yeah, they really do it well. We then created with that the collaborative alliance with the healthcare providers, with volunteers, and of course the venue of the technical college with its executive director, Doug Wagner, was just very, very well coordinated. And it did. It was a very impactful weekend for the people who volunteered and providers, as well as for the patients.
And if I could for just a moment, the Manatee Technical College, beautiful facility, full of very skilled and very important individuals who wanted to give back. Their medical students provided help and care, and under Doug Wagner's leadership, it was a very welcoming environment for all of the individuals who were participating there. But one of the key things, and I'd like for you to take a few moments if you could, is the outreach that the community participated. You had dentists that were there that gave up their time for 2 full days. You had physicians, you had nurse practitioners, you had physicians that came from Tampa and throughout the state, actually, to help participate in the program. And it just shows kind of the import and the significance of RAM, the Remote Area Medical Outreach.
Yes, in fact, we had physicians as far away as Connecticut, Texas, Georgia, such as that. We had a patient, I don't know how she found out about it, that came all the way from a remote area of Texas because of serious dental problems that she had. And I think it's a great example of recognizing a healthcare issue that we have, and then reaching out and sharing a vision with the healthcare providers and their response to that need, which we have in the community. Because in that long day and a half, there was almost $1 million of health care and education and such that was performed. And everybody got a lot out of that event. It was truly impactful in the community.
Having the opportunity to participate and tape many events throughout the county, it was certainly significant to see the size, the scope of this operation, and how smooth and problem-free the whole event was. And I think if we wanted to talk about the numbers, and we'll go over that, almost 2,000 people were served, a little less than 2,000 over a day and a half. Over 4,000 procedures were done, examinations included, type of thing. Over 1,000 dental procedures were closed. It was really a significant impact. And the key thing, and this really needs to be underlined, and again, hats off to you and your leadership for this, there was no cost to any of these participants for the care that they received.
That's exactly right. Everything was totally free. The only thing that was asked of them is, where do you hurt and where are you suffering? Nobody was qualified to have to come. It was first come, first serve, and little or no involvement with who are you or where did you come from. It was mainly, what can we do to be helpful to you, to help restore your health and such as that. And that's another thing I think makes it so impactful. This was also done at no cost to the taxpayers. There was no funding done by federal, state, or local government in this. It was done because we had some wonderful sponsors and wonderful partners who donated not only their time but their resources as well.
Well, you have this wonderful banner that that's part of the set today that kind of really indicates the scope of all of the participation by the number of organizations that assist you in your sponsorship. And they're really too numerous to mention, but it's significant that you went to and passed the word around, and then these organizations responded because they felt that they wanted not only to participate, but they felt that there was something significant that they could add to this special event. And again, the important thing is it kind of underscores the need in this community for those people who are underserved, that through no fault of their own, have no insurance or are underinsured, or perhaps they're among that working of people that don't have that full coverage that allows them to seek medical or vision or any kind of medical provisions that they may require.
Yeah, you're absolutely right, and when you look at it in our community, that number of people who are underserved or medically indigent is increasing. A significant study that was done by United Way showed that upwards to 41% of our population are either asset limited or income restrained in their capabilities, so that just to meet their needs of food, clothing, and shelter is stressing them to an extent. So quite often, those who can afford health care can't afford the deductible that their program may be giving them. So as a consequence, it's just not getting done. And when we look at the age and gender appropriate preventative studies and the impact of that on the burden of disease, it's very significant. So it's important that we as a community get back to providing the health care needs of our population.
And I think that's true, and I think you referred to what the study was. It's called the ALICE study. It was asset limited, income constrained, employed.
Yes.
And those are a significant portion of the population that are working out there and cannot afford that full extent of medical coverage. And it needs to be addressed in kind of a long-term, sustainable fashion. But again, it's really significant that you've developed this really long-term working relationship with the National Remote Area Medical that bring this back to Manatee County because there is a significant need. As I mentioned earlier, you were the 2015 event chairman.
Yeah.
This year, you're the 2016 event chairman.
Yeah.
But during the course of that year, you were also now the president of the Florida division of RAM, and you're also on the National Board of Directors, which is a really significant achievement.
Well, my long-term vision, Charles, for this is that we need enabling legislation so that we can bring professionals in who are not licensed in Florida just for a weekend to, at no charge, provide their professional services. When we are able to get that, my vision is that I want to see us have all of the equipment that RAM from Tennessee brought here stationed in Florida, so that every 3 to 4 weeks we can go to a needy community to provide these services. And for 2016, I've already identified areas we're going to start pulling together host committees in Fort Lauderdale, Fort Myers, Orlando, Jacksonville, up in Pasco County here, and Tallahassee. So including Manatee and the little town of Milton out in the Panhandle, there will be 7 or 8 communities that will be moving forward to bring this nice service to.
And I think that's really significant, Dr. Conard. With your leadership and your kind of vision, I think that's a really valuable thing, because it's just not Manatee County that has this kind of issue, but it kind of permeates throughout the state. And with your leadership and the vision of Stan Brock and his team, hopefully this will all come to a significant contribution. But I'd like to just take a moment and talk a little bit about 2016 as it applies to the upcoming event, and which we'll do another program on as we get a little closer. But I want people to be aware of the fact that, because there was such a need, you've already started gearing up and planning for the 2016 event, which is going to take place when?
The event this year is going to be November 11th, 12th, and 13th.
So you've added another day.
We have added another day, and something that we recognized is the same population that we had the privilege of serving in 2015. These people have small animals that, because of their economics, never get taken care of.
Right.
So on November 10th, we're going to have a full day of veterinary care for the small animals of these people. So we're sort of dubbing this as Ram Family event.
Yeah, that's great.
Because not only the kids and the parents, but also now the dogs and the cats as well.
I must say, and I think that's a really valuable addition to the full scope of the services that RAM offers, because there's a lot of people, who would rather have their animals taken care of than look after themselves. And, they can't afford to go to a vet clinic or anything.
Right.
So having the opportunity to have that animal inoculated or looked at or cared for is really a valuable thing, and I think that's a really added benefit, to the community to have that kind of service.
Well, you're right, and when we got done with the 2015 event, I just put out a little feeler to say I wonder what the level of interest is for having that sort of thing, and the Animal Network just really stepped up to that. They've already started to find and have found veterinarians who are willing to give of their time to do this. And when you start to boil all this down, this really equates to a community's people helping people.
It really is.
Yeah, and that's going to happen not in the stimulation of federal government or even state government throwing a lot of money at or trying to accomplish. This is going to happen with medical leadership and showing a vision where people can step up in our community and help their neighbors.
And I think it truly is significant, as you mentioned, to have these people contribute their time, their effort, and their talent, to helping others. Even throughout the dental clinic, which I thought was probably the most organized, meticulous place that you'd ever see, and people lined up for hours to be able to see a trained professional. Dr. Steve Tinsworth, other people were participating around the clock during the period of time that you were there. Trying to give back to the community, trying to help others. But now, with the added addition of a veterinary clinic, I think you're going to see, and I know you're going to see, just a wonderful outpouring of support from veterinary and veterinary care people throughout the county.
You're absolutely right, and you mentioned Steve Tinsworth. This year we've already established a leadership group of 5 dentists who are going to try to expand that participation, and Steve is playing the leadership role on that for me. Steve is truly one of our great humanitarians who gives back to this community in a lot of different ways. But that's really only the start of it. Like you said, everybody, in fact, I'm even having a lot of the sponsors from last year calling me saying, exactly when is it and when do you need to start having resources come in for this? So I think we're going to see this year even a more impactful event. And for example, one of our partners this last year was Salvation Army.
Terrific.
Salvation Army made over 2,500 sack lunches
Isn't that great?
so that we could assure that nobody coming to the clinic would leave hungry. And that's just one of the multiple examples. Florida Blue, the big organization in the state, stepped forward with a lot of resources. And when I was telling them of my vision, they said, hey, when you're ready, we want you to submit for what we call an innovative grant. And by the way, don't ask for small numbers. Come to us for what you need.
I think that's tremendous.
Yeah, we're just seeing people helping people, and I don't care what the size of the organization, right down to the individuals. We literally had to stop accepting volunteers last year because so many people volunteered. LECOM Medical Center, LECOM Dental, LECOM Pharmacy, Manatee Tech's nursing group. I spoke to the head of their nursing organization, and she says every one of her nursing students will be there this year. The same is true State College of Florida. Those people were so generous with helping us put that together. Our one gal who is in charge of volunteerism, Lori Dengler, spent untold hours. In fact, the host committee that helped put this together met literally every week for approximately 9 months, 2 to 3 hours a week.
Wow.
And then each of them went back to their subcommittees. So the logistics, which were innumerable, got put together, and as you pointed out, the end result was just a very impactful event that we were able to have.
And I would say it was flawless. I mean, it was so well organized. There was just a lot of tremendous amount of enthusiasm. You know, the volunteers were everywhere helping people out.
Yeah.
And, you know, for families and individuals who were there seeking assistance and seeking help, it's always great to have that smiling face to help you navigate the process. And it was just very impressive from the moment that people lined up until they left to, you know, after seeing a dental procedure, getting a pair of glasses. But as you mentioned earlier, there were also a number of vendor organizations that were there that were packed with information and resource material, service providers that took care of any questions that people might have. But as you kind of expand this for the 2016, you're going to have the veterinary clinic on the kickoff day, and then you'll have the subsequent days that you're providing that full range of medical service again. And the unique thing about it is it's a first come, first serve basis. You know, I believe that people lined up very early to get there. You take people in, they sign up, they get some medical history done, they are directed towards what kind of service that they would like to see. And it's a wide range of people. There's old, there's young people, there's people with children. And all of this, I again would stress, is provided free of charge to these individuals.
No charge whatsoever. And you know, talking about volunteerism, we even had some of the people who were treated last year, especially I can think of a couple Hispanics who came and says, next year, could we volunteer to be interpreters for you?
That's excellent. Yeah.
I mean, so everybody was infected with the importance of this event, and there's just no doubt. We're going to have this year an event that we hope we're going to be able to take care of 2,500 to 3,000 people.
My goodness.
As well as we're shooting for about 500 animals on the 10th to take care of, and that's going to be complete veterinary services, all the way from checking for heartworms to giving them medicine for that, to doing programs, cutting their toenails, seeing to they got all their vaccinations, and they now put a chip under the skin of a dog, so if a dog is caught, if it has that chip, they take it home. So every dog or cat that's seen will be having a chip. They'll leave with a collar as well as a license for the Manatee County.
And I think that's just really going to be a valuable service, and you're doing a great service to the community to be able to do that. But I'd take a moment too, and you know, as you mentioned earlier, you just had a tremendous show of support by different organizations, and as your banner indicates, there's large organizations and small organizations that participate in ways that they could. You know, I mean, whether it was providing a resource there, or a service, or a donation. But there's a lot of other organizations that I'm sure have approached you already or would like to approach you about how they can participate and what they can do this year as you kind of grow and expand.
You know, you're right, and if somebody wants to donate funds, they can easily donate those funds by sending them, going up on the website of ramusa.org, and if they donate, be sure and put the specification that it's for Florida. Or if they want locally, Ram Florida at box 1988 in Palmetto at 34220. And you're right, we're even having organizations now step forward, expanding their involvement from last year.
Right.
Yeah, and for example, the Rotary clubs in the community and Sarasota prepared 3,700 meals and gave out to the volunteers alone during last year's event. Tropicana gave orange juice. The canteen truck from Salvation Army was there the night before serving coffee and hot dogs and water and whatever. Everybody just stepped up.
Right.
We found that when the Salvation Army was doing their sacks, they needed some more fruit and some bars for that. Went to my good friend Dan Frederick over at Blake Hospital. He provided an apple for every sack lunch.
That's great.
And an energy bar for it. So I mean, just everywhere we went, we got an acceptance of saying, you know, this is meaningful enough that as a community, and the fact of the matter is, health-wise, we can't spend the kind of money necessary to provide health care.
Exactly.
It is a community, local issue. And I'm very encouraged that we're going to make a difference in Manatee County as we define 21st century health care, what it should be, and the realization that it is a local community solution to this. And the healthcare providers and concerned citizens and interested and concerned businesses are going to come together in this collaborative alliance to make a difference.
And I think that's really a critical thing. Even though the service that RAM has provided and under your leadership, not only for 2015, but for 2016, as you kind of gear up for that, you have to look for a kind of a long-term, sustainable approach to providing, you know, the full gamut of health care that people are looking for. And I think, you know, your voice in this community is really important to try to find out what that, you know, policy and what those steps are to make sure that that's available for everyone. Now, unfortunately, Dr. Conner, we're kind of winding down a little bit. You know, I can sit here and talk to you for hours, and this is just such an important event, and has been, you know, started. I remember when you initiated this, it was just an idea, but then you made it happen. You got these great partners together. You got communities involved. You got providers involved. It really is a significant achievement by any standard. It's a significant achievement for Manatee County. What would you like the community to know about not only the importance of this event, but also how they can get involved and why they should get involved?
Well, thank you. Yeah, and you know, I didn't stress enough, I don't think, the importance of our venue, Manatee Technical College. Doug Wagner and his leadership were so impressed with participating last year that they are taking over the vast majority of the coordination of this program this year, and we'll see expansion of that as well. I think the importance that I see is that this constitutes a collaborative alliance. We're bringing to town the largest charitable organization in America to work with, and we're having them work with our healthcare providers, our concerned citizens, our concerned organizations who want to step forward to be helpful. This is truly a people helping people type of event, and I think we're going to find that no matter how far you go, that's the solution to having a community that's healthy. Our government cannot throw enough money at health sickness to bring health care to the needy people in this country. So I guess I would have to express my great appreciation for the kind of response that we received. And it was really a response of this collaborative alliance and bringing a vision that people could relate to.
Well, Dr. Conner, you know, under your leadership and kind of guidance, you know, not only was 2015 a great success, but now as you plan for 2016 and as you approach that, your vision, your expanded vision of that is really to be applauded. Let's go through some of the details as we kind of move. It's in November. What are the dates?
November 10th will be our Veterinarian Day, and it'll be at the Braden River School behind Manatee Technical
Braden River
College.
High School.
Right. 11th, 12th, and 13th will be the actual event. first come, first serve, and those who come get a number. And unfortunately, we're going to be limited by the number of providers that we have as to how many people we can see. But if it's like last year, people will start coming the night before and camping out, literally, so that they're going to be certain to get a number. If those who wish to send $5, $10, whatever, if they will send that to Ram-Florida, Box 1988, Palmetto, Florida 34220. And if they wish, they can specify they want it for the veterinary portion or if they want it for just the general usage to carry the clinic out.
And I would suggest to you, sir, is that, as we get a little closer to November, we want to invite you back to kind of, talk about, some of the upcoming things that are going to be happening, some of the sponsors that, are participating. Maybe get a couple of physicians to talk about not only their involvement from last year, but also what they would like to provide for this year. First of all, I'd like to thank you for taking time out to do this.
My pleasure.
But secondly, you're really, again, to be congratulated for the leadership, the vision, and the efforts that you've put forth into making sure that last year's program was not only tremendously successful, but also one of the things that you, as you go forward to expand and grow the program, and again, a significant achievement, sir, and congratulations.
Oh, well, thank you so much. And I've got to expand that to our host committee because we had a lot of very, very dedicated people that really were the ones that made this happen.
Well, Dr. Conard, again, your congratulations. You're going to come back, right, sometime between now and November, kind of give us a highlight, kind of give us a prep of what people can learn and expect. And, we're anxious to hear about that. And also to talk some about, some of the key things as we move forward in developing a health care strategy throughout the county. Again, congratulations on everything that you've done. And Manatee County is very fortunate to have somebody with your leadership and your vision to make sure that remote area medical is serving the needs of this community.
Well, thank you so much. Nice to be with you, as usual.
Thank you, Dr. Conard. And if you want to find out more information about what's coming up, go to the website and find out about the Remote Area Medical upcoming program in November. And we'll have Dr. Conard back as we move through the summer to talk more about the significance of remote area medical right here in Manatee County. Thank you for joining us, and we'll see you next time on Up Close on METV.